United for Change is a statewide network of self-advocates who are uniting Georgians and influencing change by speaking up and taking control of our lives. We are a group of folks in Georgia who have intellectual and developmental disabilities, and we are working to make sure our voices are heard. Together with our allies and supporters, we advocate and make change. This video is about the COVID vaccine.
This last year has been hard as COVID-19 has made a lot of people sick, and over 500,000 people have died in the US.
The bright, shining light in fighting COVID-19 is the development of COVID-19 vaccines. Since they started giving vaccines, we are seeing dramatic decreases in the death rate, the hospitalization rates, and the rates of new positive infections. Getting vaccinated helps protect you from getting COVID-19 or will help make the illness less severe. The more people who get vaccinated, the more protection there will be for everyone in the community.
Uniting for Change advocates have been meeting regularly on Zoom and have talked with each other about the COVID vaccine that is available. Healthcare workers, emergency responders, people living in nursing facilities, people over 65 years old and their caregivers have been first in line to get the vaccine. Now, adults with intellectual and developmental disabilities and a caregiver, or a person who supports them with everyday tasks, can sign up to get the vaccine.
My name is Andrea Videlefsky, and I'm the Medical Director at the Adult Disability Medical Healthcare Clinic, where we provide comprehensive healthcare services for teens and adults with developmental disabilities. So how does the vaccine work? The COVID vaccine gives your body a recipe to create antibodies that recognize and fight against the virus. If you are exposed to COVID, your body makes more and more of these antibodies to fight the virus and prevent you from getting sick. Is the vaccine safe? Yes, the vaccine is safe. Doctors and scientists have done lots of work to make sure that it's safe. Many people have now safely received the vaccine.
Why do I want to get the COVID vaccine? I'm hoping, now this is a hope, that it will help me I'll be able to get out more, get out of this house that I've been in for a year, since March of last year.
As more vaccines are made and sent to Georgia, more people will be able to get vaccinated.
There are some people who should not get the vaccine. This includes anyone younger than 16 years old, currently have symptoms or might have COVID infection. You should not get the vaccine right now. If you've had any other vaccines, then you need to wait 2 weeks prior to getting the COVID vaccine. If you are allergic to any of the things used to make the vaccine, you should talk to your doctor or health provider. Your doctor can provide all the information you need to help you decide if you want the vaccine. Trusted family members, friends, or co-workers can also share their experiences and help you to talk to your doctor.
Callie is going to get the vaccine. She said she likes to go out a lot, so she needs to be protected.
Many people with developmental disabilities are at higher risk of more severe complications from COVID-19 infections. I urge you to say yes to receiving it.
I want to get that vaccine really bad. I really want to get it done really fast because I miss hanging out with my friends, be able to be networking with the community.
How to find a vaccine. As a person with an intellectual or developmental disability, you can register to get a vaccine now. Go to www.dph.georgia.gov. Here, you can register to get a vaccine with your local health department, with a pharmacy, or at one of Georgia's mass vaccine sites. You can also search in the vaccine locator for availability near you.
So what happens when someone gets the COVID-19 vaccine? The vaccine will be given by a healthcare professional. It's usually given in the upper arm, just like the flu shot. You may have some pain, redness, soreness, or some itching at the injection site. Most people have few or no side effects. You may experience mild fatigue, headaches, muscle aches, joint pain, chills, or fever. Some people might have some mild nausea, vomiting, or diarrhea.
My arm was really sore on the first one, And I was a little tired for like 2 days, but then after the 2 days, it went away and I was fine.
After you've had the vaccine, remember to keep your immunization card in a safe place.
I'm looking forward to getting it because now with me starting this new job in a couple of weeks, obviously I got to protect myself a lot more.
Always remember that you still need to wear masks, wash hands, and keep a safe distance. Most importantly, we just want you to stay safe and stay healthy.
This video was created and produced by Sangha Unity Network, Georgia Advocacy Office, and Uniting for Change.